and this is why. I'm sitting in the front passenger seat of a vehicle next to somebody driving, whatever that is, and they were infectious. But he was wearing a mask, and I was wearing a mask. And so I'm here today, happy to have never contracted this virus, but also as a testament about the effectiveness of wearing a mask. I want to thank everybody who sent well wishes to me, but primarily to my family, to my wife, and to my 2 kids. If there is a blessing to being unable to leave the grounds on which the yard and the house on which you live, it's that you get to quarantine with the people you love most in this world. And so I took every advantage I could out of that extra time. And so while for me and my family, things are good, state of this country and the state of our Commonwealth with regards to COVID are not. We are moving the wrong direction in a fight against a virus that at this point we understand enough about to where we should be more effective. We are seeing more cases. We are seeing more people going into the hospital. We're seeing more people going into the ICU, and we're going to see more and more people die. It is our job as a Commonwealth and as a country to turn this around. Let me first talk about what's going on in the country. Our COVID-19 cases are currently at an all-time high. That means our number of new cases per day right now is even greater than it was in the summer when we were seeing 70,000 cases in a given day. We are now seeing more than that. And we have lost 225,158 plus Americans, at least in part due to COVID. That is astounding. That in the year 2020, with everything that we know, and with being, I think, the most advanced nation in this world, that we are suffering losses on this scale. The current escalation that we are on is already higher than the second, and certainly higher than the first. And trailing the new cases we see all over the country, again, not just more than ever before, but everywhere. When we saw the first wave that's over there, it was mainly New York, New Jersey, Louisiana, and a couple of other places being hit hard. When we saw the second wave, it was places like Florida and Arizona, Texas, and some others being hit really hard. Our new wave, and what shows you that the height that it's at now could just be the start, is that everywhere is starting to escalate, like those hard-hit, smaller areas in the first 2 escalation waves. To me, I don't care what you call it as long as you recognize how concerning that it is. And what we have seen with each wave is that hospitalizations follow it. Nationally, we are seeing hospitalizations start to significantly increase again. And remember, while we're getting better and better at treating it, a certain percentage of these all-time high cases in America end up in the hospital, end up in the ICU, and end up passing away. The more overall cases, the more people we lose, and the more people who get very sick. If you look at our travel advisory, as it is right now, you see the number of states that exceed our incredibly high threshold. 15% plus positivity rate is at the largest that it has ever been. And again, it's all over America. We advise that you do not travel to these states, though depending on where you're living right now in Kentucky, we may be advising you do not travel at all. What we're seeing across the country, we're seeing in Kentucky. In our COVID cases by week is the easiest way to show it. You know, while that first national wave, if you think back on it, was for then we thought pretty large, we were able to cut it off here in Kentucky at what now seems like a pretty low volume. And while that second wave was not quite as scary as the first because, again, we'd learned so much about this virus, we had PPE and we had testing, the level of the increase was what was concerning then, the speed at which it increased. With the mask mandate and some others, we were able to basically level it off then. The scale and speed of the growth of this third escalation is faster than either of the previous two. Last week, we had our single largest week of positive COVID-19 cases, and it wasn't even close. 20+% over the next highest week. And if you look back 3 weeks at that 7,675, part of that was a backlog. And so if you accounted for that, what you would see is a steep increase over about a 9,335 cases in Kentucky is something that we never hoped that we would see. And just like nationally, hospitalization follows this rise in cases. And Kentucky's escalation started a little earlier than the nation's. So if we look at our COVID-19 inpatient beds in use, we see over the last 4 weeks a steady increase that we have reported every day. Folks, right now, if the hospital accepts you as a COVID-19 patient, and we've learned this through some personal experience lately, you are really sick. The amount of people who show up hurting that they say you don't need to be in the hospital, it is a really high bar. And so when you see this chart going up, it means a lot of people are getting a lot sicker. And remember, this trails cases by about 2 weeks. So you can imagine the jump that we see in the overall cases. We should also begin to see in the next 2 weeks that additional escalation in inpatient beds in use. ICU beds, those that aren't just sick enough to be in the hospital, which is a high bar, but need intensive care to survive, also going up. And again, if you look at that 5-week incline, it raises some really serious concerns. And today only adds to the concerns that we have over what is undoubtedly a significant and severe escalation that we are experiencing in Kentucky. We had the highest Friday ever, this last Friday. We had the highest Saturday ever, this last Saturday. We had the highest Sunday ever, yesterday, and now we have the highest Monday ever, all in a row. Today we're reporting 953 new cases of COVID-19, which, remember, Mondays we have many fewer reports that come in. This is a significantly higher Monday than we usually report, and I believe it's significantly higher than the second largest Monday that we've had. We are now getting extensive numbers of tests back, but the level and number of tests does not explain away our higher case numbers, because our positivity rate, which should go down as we get more testing, is actually going up. We're at 5.84%, and Dr. Stack will talk about that here in a little bit. As of today, we have 858 Kentuckians currently hospitalized for COVID-19, 253 Kentuckians battling for their life in an ICU, and 112 Kentuckians currently on a ventilator. When we look at new cases by county, Jefferson continues to be hit very hard with 331, Fayette with 61, Kenton with 24, Floyd County with 23, Barron County and Boone County and Bullock County all with 22, Hardin County with 21, Campbell with 19, McCracken 17, Boyd and Scott 16, Greenup and Taylor, 14. Madison and Marshall, 13. Davis, Jessamine, Perry, Shelby, and Warren, each with 10, and the rest are online. We also today have lost 3 additional Kentuckians. Remember, our numbers are also lower on Mondays because that audit committee that looks over all potential deaths related to COVID doesn't meet throughout the weekend or every day of the weekend. Today's lost lives include a 75-year-old man from Garrett, a 73-year-old woman from Graves, and a 54-year-old man from Lewis. And I've heard this comment that, well, these are people that have, we can call them comorbidities or other existing conditions. You know what the most common ones of those are? And we'll try to put this together. Hypertension, high blood pressure. Well, how many Kentuckians out there have high blood pressure? That doesn't mean you're a walking corpse. You are far from dead. It means that when COVID hits you, it makes a serious impact. What's another one? Diabetes. Hundreds of thousands of Kentuckians have diabetes. These, when we talk about comorbidities, these are things that people are living with, but COVID is something that they are dying with and at least partially dying from. It continues to impact our long-term care facilities. Today, 26 new residents, 23 new staff testing positive, 24 additional deaths can fall into what's attributable to long-term care, and 7 new facilities with at least 1 positive case. There it is. Now we show active cases versus total cases. This is an area where we continue to work really hard on, but let's just be clear. There is no barrier that we can set up at the doors of these facilities. There is no amount of testing that we can do for those that are entering this facility that can stop this virus from getting in if you have such a high community transmission that your county is red. That ought to mean that you want to do everything you can to keep your county from being red. Because when there is that level of transmission going on, widespread like wildfire, this virus will find a way to get to those that it can harm the most. We'll get to this. Let me give you a tough update from the Thompson Hood Veterans Center in Wilmore. We now have 73 residents that have tested positive in that facility. These are our vulnerable veterans that we as a state are taking care of. We now have 8 total deaths that have occurred from that facility of residents, 1 new one since yesterday. We have 4 individuals that have recovered, thank God for that, 10 that are hospitalized, and 51 active COVID-19 cases amongst those residents. Staff, 49 have tested positive, and again, thank God, 26 have recovered. If we don't push down the level and the incidences of this virus, it finds our most vulnerable, and it finds those that aren't all that vulnerable and inflicts some real pain and sometimes death on them. So where are we as a state right now? I will tell you that we have put in significant protections, restrictions, and guidance. And if you put that up, I want to go through what some of these are because we have more tools in place and more aggressive steps than we have taken than just about any other state in this country. We put in a mask mandate earlier than most states, certainly earlier than any of our neighbors, some of which still won't do this. We require that everybody wear a mask when they are within 6 feet outside of those outside of their family and those who are working inside as well. It's one of the most comprehensive mask mandates in this country, though it is similar to so many that others have now put into place. This is, if followed, if significant compliance, one of the single most significant ways to reduce the number of COVID-19 cases, and it's also the most significant way to protect yourself and your family, I would know. We put a lot of healthy at work requirements into place that stay in place. And these require huge sacrifice by those they impact. And compliance with them is how we honor those sacrifices, but they only work if people follow and do them. We have significant capacity restrictions and a curfew on bars and restaurants. We have capacity restrictions on how many people can be inside at any one point on businesses and retails, and in both of those, everybody's got to be wearing masks. Our employers are still asked to allow a certain percentage of people to work from home, 50% for those office-based businesses. Childcare, still limited to 15. Childcare facilities were already struggling. Economically, this makes it harder, but it helps to control the virus. Indoor and outdoor arenas, we've put some significant restriction levels on, and enforcement requirements that require removal of fans that will not wear masks at those events. We have a travel advisory where we advise where not to go because of the level of the virus. We've put through an executive order that gatherings at homes, informal, must be 10 or less. Long-term care, we have more testing than ever before that's going on, and there are still restrictions on visitation depending on where a county is and when there was a last positive test. Correctional institutions, again, testing and restrictions on who can visit, and that's hard on the inmates and their families. But we do it even though it's hard to keep people safe. Colleges, universities, K through 12 schools, all with daily reporting that keeps people up to date, and K through 12 schools with recommendations based on our incident map about when they should move to virtual learning. Sports, same recommendations out there about when the virus gets so big, they ought to be paused. And finally, we put together an easy-to-use 10 steps on how we defeat COVID-19. I'm gonna level with you. If more people would follow these restrictions, we wouldn't need to take additional steps. Dr. Stack believes, and I believe, that if we actually followed these, if we get everybody buying in, if we could get many of our stores back to enforcing how many people come in at any one time, and when that level of people have gone there, no more until people come out. If we could get back to wearing masks at all times when we're supposed to here, we wouldn't have the level of cases we have right now. But fatigue and I guess a cultural war that's somehow sprang up around what keeps you alive and keeps people around you alive have led to less compliance as the summer ended and as we move into fall. And now's not the time to give up. Secretary Freelander said it's the time to dig in. It's the time where more people are going to be at risk than ever. And it's the time when we need everybody to do better. To those that are working hard and doing their best, thank you, but keep it up and dial it up. To those who were at one point, we need you back. You know, it was game time a while ago, but it's now a critical point where you as a part of Team Kentucky are needed more than ever. And to those who have refused, talk to your minister, read your Bible. Wearing a mask, giving a statement about your own personal freedom, it's about how much you care about somebody else. And please don't be a person that when somebody else is worried about catching the virus, that you mock for wearing a mask or that you try to cough on or that you make a scene around. It's not okay. But the fact is we are where we are even with these steps. And as we look at our incident map, we have more red counties than ever before. Now, what happens on the incident rate map, which gets it down to the county level, when it turns red? We ask for schools to go virtual. We ask, in many cases, for sports to pause. We restrict visitation for those in long-term care facilities from their loved ones. That's what we ask. But why is the county red? It's because of widespread community spread. Doesn't mean it's necessarily happening in the schools or it's spreading because of the schools. It just will spread through the school if there's widespread community spread. But right now we're just asking the schools to bear the brunt of that. Well, I believe that we, as each one of these communities, have a duty first to prevent our county, our area from becoming red, because that puts everybody that we live around in danger. But I think we certainly have a responsibility when our county becomes red to look at all of the things that we can do to lessen the spread, to tamp down the numbers, to get back to orange and yellow. And you can view it as doing it for your own personal safety, or you can view it for getting kids back in school. So today we're going to make some red zone recommendations that we recommend for every county when they go red. And there are two reasons for this. Number one, we have a duty as a community when things are out of hand to get them back under control. That's our duty as a community of individuals. But the second reason we're making these is to protect individuals who rightfully recognize how dangerous this virus is. So listen, there are some that aren't ever going to follow the advice. So what can you as an individual that knows how dangerous this is do when the level of spread in your community is up to the red level, which means you are more at risk and your family's more at risk at getting this than ever before? So here are our recommendations, and what we recommend for each community is that same Thursday evening that we ask for schools to check. And then to plan their next week, we're asking the community to do the same, to know that we've got to live week by week in this virus. It's what it's going to take until we defeat it. So when on Thursday afternoon a county is red, we ask during that next week, starting on Monday, for all of our employers to allow any employee that can work from home virtually to work from home. We know that that's not possible for a lot of professions, but it is with others. And the more we can reduce density, no matter where it is, the better. And if those that can work from home for that week, we will see a lessening of the spread of the virus. We're going to ask, and we're going to do this on the state offices as well, that during that next week when a county is red, that non-critical governmental offices operate virtually. These are offices that can provide the services that they provide when they're in person virtually. There are some offices that are going to have to stay open, but I can't put my people that work ultimately for state government at a higher level of risk when we're asking other employers to make the same sacrifice of letting their employees work from home, and I care about my state employees. We're asking people to reduce in-person shopping for that week. Please order local, but order online, pick it up curbside. Continue to support your local businesses, but avoid in-person shopping. Order takeout. During that week, again, support those restaurants around you, but do more takeout because we have to reduce our contacts. Here's the next one that's critical, and it is from the White House. I thought it was a good suggestion. When you're going to shop in person, if you're going to dine out, prioritize those businesses that are doing it right. If they're enforcing the mask mandate, if they are enforcing capacity requirements, then you are safer. And I think you ought to ask each business in your area before going there what they are doing, or they can feel free to advertise it. That type of prioritizing where your dollars are going creates a positive incentive for organizations to do the right thing. We're asking for the reschedule, postponement, or cancellation of public or private events when it's red. So I'm not going to name a county, but there is a red county just last week that held 2 major festivals outside, no mask enforcement. And then the question's asked, what can we do to reduce our number of cases? Now, you can follow the basic guidance of public health. When it's red, if you are holding large public events, the virus is going to spread even more. Red tells you that it's already out of control, and let's not expose our citizens to any more. Next one's from the White House, too. It's their advice, and at this point, we think it's necessary. If your county is red, Don't host any gatherings of any size. Don't have people over to your house. This means that it's spreading, and we see it spreading in informal gatherings more than ever. So during that week, and again, we're just talking about a week. You learn about it on Thursday, and then, Monday through that next week. Don't have people over. It's not safe during that period of time. Avoid non-essential activities outside of your home and reduce your overall activity and contacts. If everybody in a community follows these recommendations, they are less likely to contract the virus, and we believe in a week, if people are strong about this and the community comes together to do it, that you will come out of the red in that week or at most in the next one, and that your community will be safer. But the color red is used for a reason. It's an alarm. Take it as the color of fire because that's how it's spreading. When you reach that point, your area is in danger, and we got to take action to lessen it. Now, these are not mandates. These are our recommendations on how each community can make their community safer. And the reason they aren't mandates is mandates only work if people follow them. And we know that encouragement will do more than enforcement to get people on board. But this also puts ownership in each community. We cannot succeed if our position is, well, the governor will say no. Sure, I'll say no when I need to. But if we're not doing the right things inside of our communities each day, we're not going to lessen the amount. This is about all of us who care about each other taking ownership in our fight against this virus. These are recommendations that we know, if we follow, can and will make your community safer. I'm going to ask Dr. Stack to come up and give some of his thoughts, and then we'll take questions over this and anything else.
Thank you, Governor. Good afternoon. The Governor's covered this pretty comprehensively, so I'm going to add just a few points to this. As we continue to go along this journey together through COVID-19, we are now more than 8 months into this, and things have changed quite a bit over that journey. In the spring, there was the fear of the great unknown. We really had no idea just how bad this could get, how quickly, and all the indications and the modeling really suggested a tsunami-like effect where it would just completely overrun us. And in fact, that happened in places like New York, and then we saw it happen in the summer in places in Arizona and in Houston and parts of Florida. So we knew that this could be a crisis and be a problem. And here in Kentucky, we took steps to try to minimize that risk, and we succeeded in very objective ways. We really suppressed, we blunted that curve, we flattened that curve in the spring. Then we had an increase after the 4th of July, and we reached a new plateau, and we stayed there for a couple months. And now we're in the third escalation. And this escalation is even more concerning than the first two. And we were concerned at that time, but this is more concerning because, like I've said for over a month now, we're at a much higher level of disease activity. We're running a lot hotter now. It's like the popcorn is popping in the microwave at full intensity. And if we launch from here, this is where we get in trouble real fast. So the governor has shown you all sorts of graphs and figures. In crisis communication, we're really supposed to be clear and calm and consistent and constructive. We're not supposed to be sensational. We're supposed to convey in a factual way the information you need to know to have confidence in what we're telling you, and for you to have actions you can take to try to keep yourself and others safe. I think we've really done that. I think we've really tried to accomplish that over the last 8 months and done a pretty good job with it. But I have to urge you now, this is not a moment when there's ever more for the state or for the nation to do for the individual citizen. We're going to keep at it, and we're going to keep taking the steps we need to, and I'll keep making recommendations to the governor. And I have every confidence he'll take whatever hard steps we need to try to keep everyone safe. But if folks followed the guidance we already have out there, if people followed the 6 feet of social distancing, the wearing your mask at all times in public, the washing and sanitizing your hands, staying home if you are sick, and not going to school or work if you're sick, and getting tested for COVID if you have any signs or symptoms or exposure risks that make it likely you could have it. If we did those things, we wouldn't be in the trouble we're in now. But I'll add the human component to the data the governor showed. We've had, just over the weekend, a request for an ICU transfer from 2 states away, not one of our bordering states, 2 states away, because they couldn't find a hospital in their own state that was closer, or the neighboring state, to take the patient. And we took that patient at the hospital here in Kentucky. And I spoke with the state health official from that state who was already aware of this, and we had a discussion about the things we can do to try to collaborate to help people in our own states and across states. When people go in the hospital, there is only one drug so far scientifically proven to improve your risk of death, and it is a drug called dexamethasone that was first approved for use in 1961, 60 years ago. Now, we have great progress that's being made on all sorts of research fronts, but at the moment, the only drug that increases your chance of survival is a 60-year-old medication that's been used by people for 6 decades. So we've got a long way to go. In the vaccines, we have great hope that the vaccines are going to reduce the disease and help us, but I've just got to put that in perspective. The initial vaccines aren't going to be available to people until the end of November at the very earliest, and probably not until December, and then it's only going to be a very small amount for health workers and first responders who are at greatest risk and care for the people who are at greatest risk, and then it will take most of next year to roll this out to the entire population. And even then, throughout that whole year, we are still going to have to keep a 6-foot social distance, wear masks when we're close together, wash our hands, and follow the other guidance. And so, folks, that list that's up there on the screen now that you can see, I hope everyone will listen. I'm a health commissioner, and there's the governor for an entire state. We are not here to protect one person with one set of beliefs or different. We're here to protect everyone in Kentucky and give everyone the same chance to be healthy and stay safe from this disease. But I got to tell you, it is not a good time to be out in public. This is the most dangerous it has been in 8 months. The likelihood you will come into contact with someone and could get infected if you're sitting too close at a restaurant, if you're at a bar having drinks with folks, if you're at a place where people are shouting and cheering, if you're engaged in personal parties or gatherings in your own home where you're mixing people from outside of your house, the risk of you getting infected in the state of Kentucky has never been higher than it is today. And so I have to urge, if you're listening to this, if you can be persuaded, you should stay healthy at home to the fullest extent possible. You should stay with your immediate family, minimize your physical contact with other people, and if you go out, you should wear your mask and you should maintain the distance with others. And please, be kind to each other. People have made controversies where there should not be controversies. This is public health. There's no politics in this. It's a silly piece of cloth that keeps your spit from hitting other people and the air you breathe from coming into contact with other people. This is pure public health. It's the tool we have, as inelegant as it seems and as uncomfortable as it sometimes feels. This is what we can do along with distancing, and it's both. It's not one or the other. It's 6 feet plus a mask. This is how we could get this under control, and if we followed these things, those red counties within 1 to 2 weeks, like the governor said, would not be red anymore. If we followed these things and did it for a month to 6 weeks, we would find most of that map would turn yellow and not be orange or red. And if we followed this guidance and wore these masks, we could get back to more normal life, have kids in school, people at work. So I have to encourage you, if you won't listen, then, for the well-being of others, for yourself now, it is every bit as important that you follow these rules and this guidance, and please stay healthy at home to the fullest extent possible. Thank you, Governor.
Thank you. You know, being back in the Capitol, I look around and I see the wreath that we recently laid in honor of those that we've lost. Remember, the first one we laid was when we had lost our 200th individual, 200th Kentuckian. And I think we're sitting today at 1,410 lost. It's deadly, it's aggressive, it's the challenge of our times. This isn't too much to ask to could keep your neighbor, your loved one alive. All right, we'll open it up for questions. We'll start over on the left. Nick?
I noticed that there's nothing really about sports, and people still take part sports unless I'm overlooked. It's kind of hard to see from here, so I apologize.
The question is, the red zone reduction recommendations don't include sports. It's because there's already that recommendation in place. Through KHSAA, you use the incident rate map already, and there's already a recommendation when it's red that you pause sports. So that's already in place, like schools and like nursing homes. Mike?
Like Thanksgiving, circle up your calendar. Granted, it's a month away, but given that pandemic is the most dangerous today, should people come to terms with the fact that Thanksgiving will not only look a lot different, but may not include gathering of cousins or extended family?
Questions on Thanksgiving. I think we will have guidance out here in the next day or so. I've seen it, but yes, Thanksgiving is going to be different. You should not be having elder relatives coming over at a time of COVID. You should not have people coming in from out of state. And we might say, but it's Thanksgiving. The pandemic doesn't care. Not trying to ruin your Thanksgiving. I'm just trying to keep people alive. And at Thanksgiving is a time when we thank all the blessings in our life and we act thankful. I'm thankful this year we have the knowledge that we need to keep the people around us healthy and alive. And let's show our blessings and let's show our thanks by doing what it takes to protect people.
Recommendations as opposed to mandates. You said, I'll say no when I need to. At what point will you need to?
Well, again, the question is at what point would a mandate be necessary? If you can go back to the steps that we've already taken, we've got a lot of mandates that are currently in place. We set up a structure based on advice of public health that should be enough to work, but what we need is better compliance with it. So what I care about in the end is the overall effectiveness. How many people do we protect? Where are we? And I've said it before, that's a simple equation of the rules, restrictions, recommendations, times the number of people willing to follow them. And if you move one lever too much and you see it inversely impact the other. In other words, if you push too hard with the rules and restrictions and fewer people are willing to follow them, we get less effectiveness. So at a time when we believe that it will overall have a better impact and result, that's something we'll consider. But right now I think on these recommendations we've done something we haven't in the past. These aren't just for a community, but this is to say you as an individual, because you can't control the actions of the person next to you, and some people are frustrated about not being as safe as they should because of the actions of the person that might be next to them. This is when you hit red and you want to know what to do to keep yourself and your family safe, follow them as an individual. Those that don't want to take it seriously, if they are the ones that are out, they'll be spreading it to each other. But this is a chance to protect yourself and your family, and that's something that's really important to me. Tom? Thank you.
And if I can go a little bit on the lighter side, how did you celebrate the end of quarantine with the family?
The question is, how did I celebrate the end of quarantine with my family? I took the dog for a walk. That's how exciting things are in the Beshear family. I just wanted to get out. My son and I woke up and earlier than we normally would, went for a walk and then went for another walk and then went for another walk. And it rained the rest of that day, so we were back inside. But just knowing that you can. I think most of our celebration came, especially the last time that we tested negative. My kids were troopers, but they were excited to get out. But kids handle adversity in many ways a lot better than adults. They worry about it, they get upset about it, they get it out really early on, and then they get adjusted to it. I'll never forget when my son was young. He broke his wrist when he was visiting his grandparents out of state, and it was he was right-handed, and it was his right wrist. And I kept thinking, oh my goodness, there goes the future, right? He's not going to throw anymore. He's not going to do this or that. He was doing everything with his left hand within 3 or 4 days. He was figuring out ways to get it done. They adapt, and we need to be the same. Joe?
Has actually been the return to school guidance, because obviously the positivity rates have been going up. The guidance in the school reopening says all of this stuff that was rolled out last month is in effect if the state positivity rate stays below 6.
That's correct.
Right, 5.84%. Is anything going to change if the positivity rate continues to climb?
Yeah, our current school guidance, which is what the question is about, is guidance if the overall state positivity rate is under 6%. If it climbs above 6%, we are going to take a close look at it. We will try to make a determination of how much of that may be in one specific area. But if it's determined that this is truly marking out of control statewide spread, then we may have to look at various statewide solutions, but we're not there yet. I also want to say that I think our schools are doing a really good job when they have their kids in. We are seeing some really good examples our teachers are trying so hard, our principals are trying so hard, and I think our kids are doing really well. I actually think the in-person class compliance is going better than anticipated, but I think that that's a factor of two things. Number one, amazing faculty and staff and administration in our schools, but also you see where things are in the Commonwealth. The schools get it, the kids get it, the administrators get how it could spread in these areas, and I think they've stepped up their efforts. Debbie?
Rapid tests, the feds are shifting incentive where they'll be used and also concerned about how accurate they are.
So the federal government has shipped some rapid, they're about 15-minute tests. You self-administer them, but they have to be observed by somebody that has the training. So it can allow for more testing, more frequent testing, faster results, but its accuracy is lower than the PCR test. And so it can only be a tool where we have to understand its limitations. First area that we are going to ship them to are, the federal government's shipping them directly to long-term care facilities, to the highest critical need nursing homes. Our first area is going to be prisons. On top of that, we're going to have a report, another report on that tomorrow. The outbreak in Elliott County, and that prison facility is significant. So we'll be talking about that tomorrow, along with where other things are. What we see is we're getting better and better at dealing with them once they occur, but the spread is so fast, and it's coming in from the outside. So theoretically, if you can test the corrections officers more, you can at least reduce the risk. The challenge again is when a community gets red, there's no way you're gonna keep it out. All right, do I have any reaction to Education Secretary Betsy DeVos's comments in Louisville today advocating for students to get back in the classroom? Well, I can tell you that the lead doctor on the coronavirus task force, Dr. Birx, has said what we say exactly, that we want our kids in school, but when you have uncontrolled community spread, that's not safe, and you can't be doing that at that time. Now, everybody wants kids in school, but there is just a level when the spread is simply too much. As of last week, the local Hardin County paper reported 9 new COVID-19 cases at the jail over the past week. Am I and is Dr. Stack concerned that officials at the detention center haven't been taking COVID-19 serious and allowed the virus to spread, or the potential of other local jails doing the same? I don't have any reason to believe, because I haven't seen any evidence that the local jail officials aren't working hard. I think this is a product of us taking this virus more casually over the last couple months, and that could be anybody. It doesn't mean that they work at the jail, but also, again, as the community spread continues to grow, every congregate setting is going to see more and more cases.
Is it possible that we could expect a change in Halloween guidance between now and this weekend?
Ask that again, if you will, please, Mike.
Escape the virus, is it possible that we may change your mind and alter the guidance for Halloween?
The guidance for Halloween. We do not anticipate changing the guidance for Halloween because we generally think it follows what we're asking people to do. And we also know people are going to go trick-or-treating with their kids. If you follow that guidance really carefully, it can be safe, right? That guidance is just go with your immediate family, not big groups of kids. Again, that cuts down your contacts. Second, don't hand out candy. Lay it out. Make sure you use hand sanitizer when you put it out. When the kids bring it home, wipe it down with a wipe. But we've seen pictures of some big Halloween parties in the midst of all of this. Again, that's spreading the virus. It's making it harder for us to get back to our old normal or even a new normal, and we just need better than that. I talked to another governor today, and we're of different parties, but one thing he said to me when looking at these pictures is we are seeing a striking disregard for the health of our neighbor. Now, I think that is the exception. I believe there are a lot more people who are fighting for the health of their neighbor than against, but this is personal responsibility. And some of the worst instances seem to be from people who preach personal responsibility. Can you be responsible to control yourself enough to follow the guidance and protect your neighbor? Do it for your faith, do it for your family, do it for yourself, because the more people who are casual about it, the more it spreads, the more that you personally are likely to get the virus. Karen?
Touching base with a lot of the health departments in our listening area, which is Central Kentucky. And for quite a while now, they've been overtaxed, obviously understaffed for all the contact tracing. How concerned are you that they'll be able to keep up with it as the numbers rise?
The question is on our local health departments and the outside contact tracers that we've supplemented them with. How concerned, and first, they're doing a heroic job. They are tired, and we all are that are fighting this on a daily basis. Our nurses and doctors are tired. Our long-term care facility workers are tired. But you know what? We got to gut it out because that's what it takes to protect people. But I want to thank them. I mean, they got people yelling at them that it's a lot more personal than when they yell at me because they know them and they're in their community. We got people knocking on their doors late at night. That's really wrong. I mean, where are your manners? But there is a serious concern that as the cases increase, contact tracing becomes more and more and more difficult. When our cases are 9,000 plus in a week, it's really hard for contact tracers to chase each one down. And we still see some examples of people who won't pick up the phone when they call. Now, there was a national expert on one of the cable news shows the other day that said that one infectious person who doesn't isolate, who doesn't follow the rules, can infect 400 other people. Think about what that means for each of our individual personal responsibilities and how important it is to be able to contact trace. That's what we've always said. We got to keep the numbers down enough, and we got to be testing enough for contact tracing to be effective. Here's my other concern. Without a new CARES Act, all our money for contact tracing runs out December 31st, and testing at long-term care facilities, and testing at prison, and testing in general, and PPE that we need to buy, and all the extra assistance that we're providing to various groups out there. So I'm concerned with where we are on contact tracing right now, but if we don't get another CARES Act, December 31st, we fall off a cliff and won't be able to contact trace a small percentage of at least what we're seeing now. Tom?
Speaking of contact tracing, the last time you had a gentleman here who's overseeing the program, he said there were 1,240. Is that, they wanted a higher, I guess, a couple hundred more.
So we can get an update this week on contact tracing. Let's bring Mark Carter in and get the full rundown. Mark's done a great job. I mean, he's a long-term healthcare professional who had managed hundreds of workers in a multi-billion-dollar business and has done a good job of putting the system together. We also now, I believe, have every local health department. I think Fayette County transitioned at the end of last month. or they're transitioning right now on the same statewide system, which will allow sharing of information. And it's also a system we can use for anything in the future, or things that we regularly see that we need to track. I think we've worked out most of the kinks with the way the contact tracers were hired and how they help people out there. It's just we got a lot of virus, and that's our challenge. Joe?
I have a couple questions about hospital capacity. I'll just tackle the same question. As far as the surge protection that the state has been kind of going through with hospitals, where is that at, and where do you see, maybe more troubling situations in Kentucky in terms of hospital capacity? And kind of in that same light, what is the status of field hospital at the fairgrounds or any other places, I guess, that need to overflow capacity?
So the question is on surge preparations, specifically hospital capacity, when we would look at making changes, or why don't you ask it again if I'm not hitting it exactly right.
The state is engaging in surge protections with hospitals. I just wanted to see where those are at with hospitals and if you've identified particularly troubling areas in the state.
So on hospitals, and can you put up the rate of hospitalization? One of the main concerns we have about this escalation, so that is nationwide. Also look at Kentucky. Is the fact that it is increasing. It is the direction that it's going that requires us to make preparations. As of today, our inpatient beds are at 63.9% full. So we still have capacity, but with our number of cases that we are seeing and hospitalizations trailing by a week or two, it can increase pretty significantly. What we're looking for out of our partners is a bit of, and we're going to be talking about this later in the week, reworking of their plans. So our hospitals become better and better at treating COVID-19. That's a really good thing. It means that they can expand their own capacity if necessary a little bit easier than previously, because we think we will see more hospital beds. We won't necessarily think we need as many ICU beds as we did in the past. So we think hospitals have a larger ability this time around, if necessary, to increase the number of beds in their facilities. So there is, at this point, not a concern with elective procedures. Those can and should continue, but the planning has to be there if and when we see the escalation continue. ICU beds, they're about 70%, and that is a little more concerning. Ventilators, we still have significant capacity. They're only at 27.6%. Field hospital, we believe we can set up within about a week to maybe 10 days. It is right now stored at the fairgrounds and can be put back up there immediately. What we did that others haven't in this country is we did it all ourselves. We had between our OIG in Health and Family Services and our head of Homeland Security, significant amount of experience in and putting together that field hospital with others. We own everything but the dividers that we would put up between where we would put people, and so we're going to have the ability to use it at a week's notice. And right now we don't see the need for it, but you're right, and part of the question is space can run out in certain areas faster than others. So if, for instance, we saw a significant push in hospitalizations in Louisville, it grew to an alarming level, we'd put it up even if there's room in other parts of the state, because we've seen in the past a nursing home may suddenly have a number of patients in crisis and you've got to move them. We have seen in the past Bowling Green get pretty close to full, and a couple of other areas. What it'll do is it'll flare up, but then they've been pretty good at pushing patients out when they can. But that's a conversation we're going to have with hospitals. They've been engaged, but we've got to be re-engaged to plan and prepare for it.
You're concerned about the escalation in counties where
That's a good question. The question is, and we didn't do a fast for today because today's pretty serious in where we are and what we've seen. But for the election, it's really important that people vote early at this point. With where the virus is, vote early. Pick a time that you don't think there's going to be high density. You should go vote. You need to go vote. If you vote early, you wear your mask in and out at a time when you don't have to be in for a long time, you will be safe. But we don't need a high density packed election day itself. But we still have 8 days, and we'll have Saturday hours, so there's plenty of time. Just make sure you get out and get it done. We still want a record election, a record turnout. I think we were on pace to get it. I believe Secretary Adams and I worked very well along with Jared Deering to create a safe plan, but part of the safety of that plan is spreading people out about when they vote. So please vote, but please vote early. All right, it says the Beshear administration previously ordered shutdowns of certain businesses to halt transmission. Other cities such as El Paso have instituted curfews to curb transmission. Are we considering enacting similar policies? We do have a curfew for restaurants and bars. Right now, we're not considering a broader curfew than that. We want to be surgical in how we approach the virus, especially in terms of business. We also want to make sure what we put in will be followed and that we can preferably enforce it where possible. On Monday morning, President Donald Trump reasserted that cases were rising in conjunction with testing. Our positivity rate shows that we have more virus. Yes, we're testing more, but we have more virus even compared to that amount of testing than we have in a long time. There's no question we are nationally and in Kentucky in a third escalation. We don't need to find reasons around it. It's what we face. Recognize the challenge, recognize the problem, be a part of the solution. We can save lives. Early on at the point of shutting down businesses, we used shutting down businesses to flatten the curve. Cases are now at their highest level in Kentucky since the pandemic began. And the administration has said restrictions that are in place are enough if people would follow them. Why we place so much emphasis on personal responsibility at this point in the pandemic when restrictions and shutdowns effectively flatten the curve in the early months? Let's remember the early months. It wasn't just what we put in place. It's that just about everybody followed them. It's that people were doing their civic duty and they wanted to beat this darn virus. And we can. We absolutely can. Now, fatigue and others have meant that compliance, even with the mandates that we have in effect, aren't where they need to be. But if not enough people are following the rules, the solution isn't just more rules, right? It's that we need more people out there doing the right thing. And personal responsibility is something we in Kentucky have always talked about as a value. And again, the effectiveness of what we do, has two major factors: the rules and regulations times the people that will follow them. And you got to get that in best alignment that we can. Last week, some Senate Republicans held a press conference and announced they were working on legislation regarding the overpayment issue. Do I support a legislative fix? We've asked for a waiver from the federal government on this issue. They have at least suggested they won't give it, but we went ahead and put it in writing. Yes, we can't simply waive it as an executive branch, but if the legislative branch does it, I am fully for it. And finally, what does the governor and Dr. Stack have to say about the president's false and or misleading statements about the pandemic, such as his claim that a person who is terminally ill with cancer would still be labeled as a COVID-19 victim? All right, that was the question. I did not hear the statement about a terminally ill individual with cancer labeled as a COVID-19 victim. But let's remember here in Kentucky that we have a group. They look over those that have passed away. And if somebody was already in that hospital dying of that terminal cancer, just like that person in the car wreck, they'll look at those circumstances. But let's say you're somebody who has terminal cancer, but they say you've got X number of years to live, and you get COVID and it creates pneumonia and you pass away, right? These aren't just examples that you pull out. They are real world issues, but we talked about it today. People want to say these people are already, this is trying to say The Walking Dead. They're people with diabetes or hypertension. And when you look at Kentucky, so many of us have what would then be labeled a comorbidity, right? And we live with them. And we were even living with them through this virus. So, yes, in this virus, it may take whatever you're already dealing with, but is stable, and together the two of them may take your life. I'd say that that's COVID being pretty dangerous. You know, we're I don't want to get involved in directly involved in this presidential election, but we're not rounding a curve. It's getting worse, and we need to recognize that challenge, and we need to respond to it as a Commonwealth and as a country. I can't impact on the country level, though we do communicate regularly with the White House, and their direct communications with us, you know, are different than some things that may be said out on the campaign trail. What I do know is my responsibility is to Kentuckians, and the recommendations we put out today aren't easy, but they will help, they will work, and they will lessen the virus. So we are in a dark, difficult time that's about to get darker. But, you know, they say the night's always darkest before the dawn. There is light in our future, and we don't have to wait till a vaccine to make things better for us. But we do have to take responsibility. We do have to say when our community is red that we all have a responsibility to protect ourselves and to protect one another and to do what it takes to make sure that our local economy thrives, that our schools can be open, and that we don't see our neighbors around us and our community passing away. This virus is a test. It is a test of our basic humanity. Do we care and love for one another? And are we willing to continue to care and love one another after 8 months of difficulty, not even difficulty, of inconvenience? It's a test of our strength. It's a test of our will. And unfortunately, the success or failure in that test is marked with disease and it's marked with death. But our success can be about those we protect. It can be about what we're willing to do together. So, Team Kentucky, we need you. Your local teams, your local communities, we need you. Protect yourself, protect your family. Again, I'm standing in front of you negative because even when I was sitting next to someone who had this virus, he was wearing a mask and I was wearing a mask. Sometimes it can be that simple. Thank you all, and we'll see you at 4 o'clock tomorrow.